All right, good afternoon, everyone, and welcome to this month's Teach Educational Rounds. Here with us today, we have Dr. Osnat Melamed, who will be presenting on a woman-specific smoking cessation app, results from an acceptability study. And we're going to start today off with CAMH's land acknowledgement. CAMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase, Treaty Number 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. So now is the time where I invite everyone to identify where you are joining us from today and share that in the chat. And you're also welcome to share something that you are currently doing to learn or improve your commitment to reconciliation. I have a link, if you're unsure which land you're joining us from today, I have a link that I just put in the chat that you can use to find out. So I invite everyone to share. And in the meantime, I'll just get going with my own personal land acknowledgement. My name is Rachel. I am a second-generation Canadian located on the lands of the Mississaugas of the Credit, which is covered by Toronto Purchase Number Treaty 13. I continue to listen and learn about the stories and cultures of various Indigenous communities and ensure that their voices are heard. So everyone's welcome to continue sharing in the chat or to use the link to find out where you're joining us from today. And I will just continue on with some more housekeeping items. First, a reminder that if you are interested in receiving a letter of completion for this Teach Educational Rounds, to make sure you have one registered for this webinar and completed the pre-learning assessment with the registration. Also, to make sure that you have signed into this webinar using your first name and last name. And finally, to complete the evaluation and post-learning assessment, both of which will be sent out to you following this webinar. And so a bit more about Dr. Osnat Melamed. Dr. Melamed is a clinician scientist within the Campbell Family Mental Health Research Institute and a staff addiction physician at CAMH. She is also an assistant professor in the Department of Family and Community Medicine at U of T, where she holds the 2023 New Investigator Award. Dr. Melamed is an early career investigator with research interests in tobacco addiction and the intersections between substance use, mental health, and gender. Dr. Melamed is interested in the use of technology for the delivery of treatment for substance addiction. She develops innovative digital health tools such as smartphone apps and AI-based chatbots to support individuals in quitting smoking. And here are Dr. Melamed's disclosures. I'll give everyone a moment to look through those. And just to note that all eligible Teach Educational Rounds presenters are offered an honorarium. However, acceptance of this honorarium does not impact presentation content. And just to note that the following content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. And these materials, as well as any verbal discussion and presentation, represent only general principles and do not remove the need for clinical assessments or treatment plans by healthcare professionals. And so that's all from me. I will now pass it on to Dr. Melamed to get started on her presentation. Thank you.
Thank you very much, Rachel, for the introduction, and welcome everyone to Teach Rounds. I'm located here in Toronto, which is a snowy day, and I'm sure at other parts of the country as well, so welcome. Our topic for today will be to discuss some of the work that we've done creating a woman-specific smoking cessation smartphone app. We've tested it with 30 women, and I'd like to share the results with you today. So we'll start by talking about the learning objectives, or really the topics that we have for today. So we'll start by talking about some of the sex and gender differences in motives for smoking, and also what makes it hard for women to quit smoking, or the barriers to quitting. We'll talk about how we incorporated some of those differences that we are aware of into the content of the My Change Plan, the smartphone app for women. And lastly, as I mentioned, we've recently finished a study where we gave the app for 30 women who smoke and wanted to get their feedback on whether this app was helpful for them. And as you can see here, the right-hand side, I've included an advertisement that came actually from Australia, which talks about some of those sex and gender differences. So for example, on the left-hand side of the picture, you can see changes in health when people quit smoking, which are generally similar, for men and women. But on the right-hand side, you can see that there are some specific messages that are tailored to women. For example, in 1 month after quitting, skin appearance tends to improve. And lower on the bottom, you see that we want to, this ad is encouraging women to quit smoking in order to think about pregnancy outcomes. So again, using, a sex and gender messages, tailored messaging to improve or encourage women to quit smoking is not something that's new. It's been around for quite some time. I wanted to talk also about some of the epidemiology, for example, prevalence of smoking. We do know that more men than women smoke. About 14% of males and 11% of females today smoke in Canada. And we know that there's been greater decreases in smoking in men rather than in women. And the next slide will show a figure about that. We know that in low to medium income countries, there is an increase in smoking rates among women, which is concerning. And in high income countries like Canada, we see that the women that are smoking, the minority of women that smoked, about 10-11%, we know that it's concentrated among women with socioeconomic disadvantage, blue collar professions, people who are, live in poverty, sometimes, women who have other mental health or addiction issues. So we know that today smoking is concentrated among women who have other health issues, usually other mental health issues, other social issues that are troubling them as well. This graph shows us the timelines of the tobacco epidemic, and the axis here, the y-axis, the x-axis on the bottom shows us about, a timeline of about 100 years, dating back to around the 1920s when the first commercial cigarettes became available, up until today, more or less. And the green line shows us how tobacco, smoking there's been an uptake among men that has been quite robust, hitting kind of an all-time high in the 70s. We had over 60% of men smoking. But what we can see is, and we're all aware that smoking rates have gone down. So we kind of see that graph trending down for men. Now, if we look at the dotted or the dashed line, the green one, this shows the deaths of among the men with regard to tobacco-related deaths. So what we can see is that this graph sort of lags behind the prevalence. So first you have, a lot of men smoking, but then 20, 30, 40 years later, you see the deaths that are attributable to that, to smoking. And as you can see, we can kind of see it peaking, but then we can kind of see it trending down. Now, this is in comparison to what we see among the women. So we see that less women smoke, as we mentioned earlier. We know that. But what we can see is that the trend in the number of women who smoke, or the prevalence, is lower. I mean, the curve doesn't trend down as much as it does for men. And so we know that, women have potentially a greater, harder time quitting smoking after they've started to smoke. And the dashed line, we see something even more concerning, which is, that the deaths that are attributed to smoking are still sort of on the rise in women. So we know that when women smoke, they may have a harder time quitting, and also they may face greater health problems because of smoking compared to men. And how can we explain this, that, the health effects of smoking are different, for a man compared to a woman? And one of the things that we think is behind it is the physiological differences. One thing very apparent is the body size. For example, we have clothes for men and women that usually are different in size. Men are larger, but then again, we don't have a cigarette for men, which is larger, and a cigarette for a woman, which is smaller, meaning that, if a man and a woman would smoke a pack a day, this would, lead to greater toxicant exposure, greater chemical, carcinogen exposure. And that could explain, for example, why even though men and women could be smoking the same amount or having the same exposure, women are more susceptible to developing lung cancer, for example. This is also true that when women smoke, they have greater harm with regard to the, lung function. So COPD will be expedited. And we also know that that's the case for coronary events, both heart attacks, myocardial infarctions, and strokes are more likely to happen in women who are smoking compared to men. We also, want to acknowledge that there are women-specific motives for smoking and also barriers for quitting. So, with regard to motives for smoking, more women than men tell us that the reason that they're smoking is because smoking, or specifically the nicotine, the stimulant effect of nicotine, helps them suppress their appetite. And that's a way to reduce weight. So for example, after a meal, if I'm having a cigarette, maybe I won't reach out for having, a dessert, and that will help me control my weight. And in fact, we know that this is true, especially among girl and young women. Those who are overweight are more likely to pick up smoking to control their weight and help them not gain more weight. Another thing is that we know that more women than men tell us that the reason that they smoke is to cope with the stress in their lives. And a bit of a protective factor, we know that when women are planning to become mothers, if they're pregnant, or if they are mothers, they're more likely to think about quitting smoking and wanting to quit smoking. And this has to do a lot with our societal norms and pressures that are put on women to be healthier for their family, not just for themselves, but also think about their families, which motivates a lot of women to quit smoking when they're planning to have a family. What are some of the barriers that women face when they want to quit smoking? So, we all know, I mean, all of you here on the line are working closely with people who want to quit smoking. And we know that the social support, just having someone around me, that cheers for me, roots for me, if it's friends, family, coworkers, that social support is so critical to just keep me on track, not give up. And many women tell us that they don't have that social support, that they don't feel someone is rooting for them or supporting them. And that can be, that can make it harder to quit. We also know that sometimes power imbalances between the genders can play a role. So for example, if a woman is living with a partner who is smoking, she's less likely to quit compared to the opposite situation. So men who have a female smoking partner don't find it harder to quit, but for women it can be a challenge. We touched upon the fact that women tell us that smoking is a method for them to deal with unpleasant emotions. This could be perhaps if if I have depression, if I have anxiety, if there are other sort of life circumstances that are difficult for me. And one of the theories that has been tied with this is the sociopharmacology theory, which posits that social determinants of stress become a conditioned cue for smoking. So similar to other cues that we may have in our life for smoking, if it's different behaviors, different places, also the, different stressors in life, like for example, if I'm experiencing domestic violence, if there's been trauma, if I'm really stressed about the fact that I have to, manage my work and the kids at home, or if I have a financial stress, that could sort of make me, become a cue for smoking. So every time I'm in that situation, the thought of having a cigarette comes to mind, and that's more pronounced among women than men. Nonetheless, we know that the same proportion of women who smoke is similar to the proportion of men who smoke who attempt to quit smoking or want to quit smoking. But we do know that the success rates are lower for women than men. We also know that sometimes women are successful in just initiating the quit, but the challenge becomes in maintaining this. So maybe I'm able to have a day without smoking or 2 days without smoking, maybe a week. But, we want to make this stick. We want to make this, maintained. And then a lot of the times stressors in life just make it really hard to maintain. And we know that women, this is from one study that was published, women had, a 31% less success of quitting smoking compared to the men. And we also know that this is true from our own STOP program. This is a study that was published just a few years ago using the STOP data, so probably including men and women that you've worked with in the practice. And we know that the women were less likely, 16% less likely to quit smoking than men. And this was after we controlled for, known things that interfere with smoking, like heaviness of smoking, mental health, socioeconomic status. So this 16% difference was only related to the sex, whether this was a man or a woman, not to other factors. And if you look at the quit rates, it doesn't sound like a huge reduction, like, 24% of the women quit compared to 27% of the men. It doesn't sound like a huge reduction, but if you think about it, it's, a number of women that were actually not successful in our program, whereas the men were successful. So, and we know that quitting can be so important for health. We talk about roughly, half of the people who smoke long-term will die from tobacco-related illnesses. So this, does translate into some meaningful clinical differences that we should be aware of. Another thing to mention when we think about men and women success in quitting smoking is how effective are the medications that we give our patients. And this is a meta-analysis that was published a couple of years ago. And what this comes to show is that whereas, men, if we give them bupropion or Zyban, varenicline, or nicotine replacement, all of the three medications, men are equally successful when they're using those. So it doesn't really matter which one you give them, they'll do equally well. But for women, it's different. Women do less well with bupropion and with nicotine replacement and do much better with varenicline. So in women, this difference was statistically significant. So women were 40% more likely to quit if they were giving varenicline compared to bupropion or the patch. And, currently our guidelines don't call for that at the moment to give, women different treatment than men. We kind of have a one size fits all. But it is something to consider that the evidence is there that some medications are more effective than others. We also want to highlight some of the experience of the quit attempt that is different between men and women. So women tell us that when they try to quit, they experience a greater degree, or they rate their withdrawal symptoms to be greater than what men tell us. So there's more withdrawal-related discomfort, therefore leading to more relapse. And one of the things that we notice is that women are particularly vulnerable to failure if they're quitting in a cold turkey attempt, meaning they're not taking any smoking cessation medication. And sort of it makes sense to have this outcome, because if my withdrawal symptoms are much greater, to, that kind of, again, the experience of women, So if I don't take a medication, it's going to be really hard for me to overcome those withdrawal symptoms. Whereas, men tell us that their withdrawal symptoms are not as severe. If they don't take a medication, perhaps it's easier for them to quit without any medications than it is for women. And just sharing, something that's very known, the nicotine withdrawal symptoms can be quite debilitating, especially if we talk about sort of the mood issues like irritability, frustration, feeling angry, depressed, restless, having some sleep issues. So if women tell us that they're feeling more of that, that can explain why it's harder for them to quit. These are, things that do make you very uncomfortable. Although they last for a short time initially, they are something that will make it hard. Therefore, the rationale for using medications to help reduce these symptoms. Another thing that I want to mention is some of the sex differences in the ability to quit. And we talk about hormonal differences, specifically the menstrual cycle, the hormones of the menstrual cycle in women, and how do they affect quitting. So currently we do have a study, an ongoing study in our nicotine dependence clinic / Intrepid lab. We do have a study led by Dr. Lori Zarateo, who is looking into whether timing the quit attempt to a different, to a specific part of the menstrual cycle will be beneficial for women. It's sort of to be determined. We don't know. But from, what women tell us, there is, we do suspect that when women try to quit in the later phases of the month, what we call the luteal phase, or days 15 to 28, that's when they're having a greater difficulty in quitting compared to if they're trying to quit smoking at the earlier stages of the menstrual cycles, days 1 to 14. And one of the things that, a lot of women notice is that during that luteal phase, especially kind of the later days of the, before the period, the monthly period, we do talk about PMS or premenstrual cycle, where women do tell us that they have mood swings, irritability, some changes, physiological changes like swelling, changes in appetite, changes in sleep. And of course, if I'm trying to quit smoking and nicotine withdrawal already causes me some discomfort, if we combine that with some of the effects, the hormonal changes that happen month after month, that may make it harder for me to actually, resist smoking in light of all those things that I'm experiencing. Okay. Right, so this is a summary slide for just our background, saying that we know that quitting is influenced by, a number of sex and gender related factors. This could be related to biological differences like levels of hormones, the effectiveness of the medication, like we've shown. And it could also be related to psychosocial things. It could be related to stress in my life, minority stress, lack of support, and other experiences of mental health, addiction, trauma. Therefore, we do think that it makes sense that if our smoking cessation intervention will address these factors, it may be advantageous for women to quit if we specifically, touch on those things. Yeah, and just a kind of a general slide to kind of sex versus gender. So we do talk about some of the gender differences like caregiving burden, financial stress. Women do make less money compared to men, therefore may have more financial stress, especially if they're in situations of lone parenting or things like that. And, those could be added to stress and increasing the value of smoking for a woman that is in that situation. So that would be related to sex. Things that are related, to gender, things that are related to sex would be response to medication and hormonal changes, for example, but there are others. Okay, so now we get to a little bit of that, to talk a little bit about the work that we've done with the smoking cessation app. So one of the reasons that we chose to use a smoking cessation smartphone app is the thought that the smartphone apps, most of us, I think over 90% of people or Canadians have a smartphone, and we can, it's quite accessible, and people who are perhaps do not have access to a smoking cessation clinic or a smoking cessation service, potentially this could be a helpful tool for them, overcoming geographical barriers. We also know that, the fact that I need to come to see a healthcare provider for my smoking cessation, it's another added burden. Perhaps I'm busy with caregiving responsibilities, other things. I don't have the time, potentially competing demands. Therefore, having an app could just deliver some of this information and support that could be helpful. And I think one of the greatest, advantages of digital tools is they're highly customizable. We can tailor the needs of the specific population to the content, into the content of the app that we deliver. So we'll talk a little bit about the app itself, which is called the My Change Plan Woman. And it's, I want to emphasize that the app that we've created was actually built on the platform that was existing. I'm sure many of you have heard about it. It's called the My Change Plan app, which has been around for a little bit of time already. It's a gender-neutral smartphone app. It has a lot of the behavioral change techniques that we teach people in the clinic. For example, tracking, being aware of their smoking triggers, developing healthy coping strategies. And it was developed in collaboration with clients, clinicians, students, scientists, and also our colleagues, at the University of Toronto who developed the software of the app. Dr. Nadia Minian was responsible for the early development of this app. And it's currently up, alive, and it's free to download. It is maintained at CAMH at the moment. So what does the app, the gender neutral app, the My Change Plan app, has to offer? So it offers psychoeducation on tobacco dependence so people can understand why it's so hard to quit smoking. Also the health effects and how we treat tobacco use and some of those behavioral strategies. A really important part of helping people quit smoking is just gaining awareness to smoking triggers using self-tracking. Also being, sorry about that. Also being very deliberate about a change plan. What are my coping strategies? How do I deal with cravings? And just having some encouragement notifications from the app. If I had a smoke-free day, encourage me to keep going. If I've saved money because I didn't smoke, that can be quite encouraging. So a lot of those behavioral things and encouragement are in the app. And sorry, went backwards. And this is a little bit, this is a screenshot. I think someone mentioned in the audience, this is a screenshot of the app, of the version, the one that's available currently. So we have a lot of information on different medications for smoking cessation, sleep and quitting smoking, alcohol and quitting smoking, physical activity. So quite a lot of information that people can go through and improve their knowledge, and hopefully that will help them make a successful quit. This is sort of what the tracking looks like. I track my cigarettes according to my mood, and I notice that I tend to smoke the most when I'm bored. So that will prompt me to think about some coping strategies for boredom, maybe going for a walk, listening to music, doing the dishes, laundry, whatever I think might be helpful. Cigarettes by location. Again, I tend to smoke most of my cigarettes at home. So that means that, I need to come up with some strategies, maybe make my home smoke free, and other things that might be helpful for me. We also have my coping strategies, which is on my motivations, my changes, my support team, which is individualized. People enter information into that and can look it up at a moment of need. These are the notifications that I mentioned, getting congratulatory messages from the app for being smoke-free, for smoking less than the day before, and so forth. So this is when we talk about, what changes we've made to the app. How did we tailor it to women? So a big part of this was co-creating materials or content with women who smoke cigarettes, and we've had 5 patient partners from the clinic who were working with us to create this content. So overall, the layout of the app remained pretty similar. And we maintained gender neutral content that we discussed in the previous slides, but we've added one tab, which is women talk about their quit journeys. And this included 2 components. One is testimonials and the other one is animation videos. So the testimonials were women telling us, why it was important for them to quit, but also, how they faced some challenges, what helped them overcome the challenges, and also, a lot of encouragement. So this is sort of one tab of testimonials. And the second tab was, testimonials and animation videos. We created 4 animation videos where women talk about their quit journeys. And we are able to, Rachel will help me to show you one of those videos, which is women's dialogue, or it's a group of 3 women. You can see them here. And they're talking about, what made it hard for them to quit smoking, but what was helpful, what they did to overcome those challenges. So I think, Rachel, this is where you take over and share the video.
Sure, 1 second.
Thank you.
Just the amount of time I've been a smoker at this point makes it harder, as smoking has really become ingrained in my everyday routine.
Doctors usually tell you you should quit, but they don't give you a path or suggestions. Everybody in the room agrees I should quit, but how do I do that? In the past, I had a reliable relationship with my cigarettes. Cigarettes were my best friend, and sometimes my only friend. I really didn't want to quit. I was kind of ambivalent about it.
Having to deal with other important things in my life, like not having a place to live in or having financial struggles, did not allow me to focus on quitting. Some ways I have found to cope with stress is to really talk through stressful times and emotions, to reach out to my counselor, a friend, my mom, someone who can help me see that the extreme feelings are not going to last forever.
For me, it was learning to acknowledge to myself when I was feeling overwhelmed, and then quieting my mind. I tell myself to stop and then take 3 deep belly breaths.
I have a dog, and I play with him. It's a real form of joy. I also exercise. That helps me de-stress.
Being sober for more than 5 years has helped me because the chaos and the stress of being underhoused and in extreme poverty has become non-existent for me, and this reduces my stress. Also, going for a walk or doing a workout video at home definitely helps to cope with the stressful moment. My family is supportive and not pushy about the quitting process, and my friends are mindful to try and not smoke around me when I'm trying a period of abstinence.
People who have never smoked, they don't get how hard quitting is. It's much easier with a smoker because they just know how hard this is.
I found it more helpful to talk to other smokers, and especially other women smokers who quit. They would relate to what you were going through. That was key.
I got referred to some group by my doctor, and to see those people and everybody's successes and failures, all those things are important to me, and they really helped me.
I got connected with a text-based app about smoking, and so every morning I'd get a text, and that was also kind of good.
Stop hanging out for a little while if necessary.
Well, the only place cigarettes come into my life is at work. I'd rather do something else, indoors. Probably keep working than just go out and stand with the other smokers.
I still don't go outside with friends who smoke.
Share that you want to quit smoking and you will need support. Asking if your activities together not include smoking anymore. Realize how long smoking has been a part of your life and that it will take time, commitment, and dedication to also have it not be part of your life anymore. Never give up. Just keep going despite setbacks.
For me personally, having someone in my corner that I can talk to when I wanted to smoke.
It might take you many tries, but eventually it might work. It is hard, but don't stop trying. Ever.
Okay, thanks very much, Rachel. So I'll continue. So yeah, so happy to share that one of the videos, all of them, by the way, are available on the Teach YouTube channel to watch. But I thought this was a really nice, kind of example of one of those. Okay, so now what we've done is take the app, the My Change Plan, improve it or add content that is specific for women. And we recruited 30 women, and a lot of them came from the STOP community. So we recruited 30 women that were open to testing the app for 28 days and tell us what they think about it. And our main question was to ask whether this app is acceptable. And the way we termed it is really, is the app helpful? Do you think that the app can be a helpful tool in your quit journey? And the question, the statement that we put, using the app is likely to help me make changes to my smoking habits. And women had to rate what they think about this, from strongly disagree to strongly agree. We wanted to have at least 50% of the women, this is what we were hoping for, to have at least 50% of the women or the majority of women tell us that, yeah, this is, I agree with this. This tool is going to be helpful for me. So this is what we kind of were hoping to see. The feasibility, because we are working with an app, we only know that apps, will work if you use them. So, if a person doesn't use the app as much, it's unlikely that it will have an effect on their behavior. So we wanted to know whether women would use the app for at least 7 days. So if, all the women that use the app for 7 or more days, that would be kind of that would be kind of the number to look for. And again, we wanted the majority of women to use the app for at least 7 days in order to say that the app is feasible. One thing that we did after the women completed the trial using the app for 28 days, we interviewed them and wanted to elicit their feedback. Did you like the app? Did you not like it? What are the things, the elements that the app has that can help women change their smoking? Also, whether the topics that we looked, we put in the content, whether they were helpful for women. And we also left it for suggestions. How can we improve the app? So these are the results. describing initially our sample of 30 women that tested the app. We see that most of them were middle-aged women between the ages of 41 to 60, although we had, a sizable proportion of younger and older women who tested the app. We see that the average household income was between $40,000 to $80,000. About a third had less of that. These are usually people who are retired or fixed income like disability. But we had also kind of a sizable proportion of women who were had greater income than sort of the median range. And the results. So we wanted to test, whether this app is acceptable by asking women to rate the statement, using the app is likely to help me make changes to my smoking. We're really asking women, is this app helpful? And as I mentioned, we were hoping to get 50% of women at least to agree or strongly agree with this statement, but the results proved otherwise. We got about a third of women, 11 out of the 30, that told us that they agreed or strongly agreed with this statement, which is a little bit of a disappointment. We were hoping to get more buy-in from our sample, from the women that tested it. And then we decided to look into this result a bit more, fine-tune the results. And we said, okay, let's compare, women who used the app a lot, like used it more than 14 days, and women that used the app a little bit, less than 14 days. And what we saw is that among the group that used the app a lot, the majority did find it acceptable, 64%. And among the women that didn't use the app so much, some of them just use it for a day or two, very few found it acceptable. So I think what we also recognized is that we don't have a one-size-fits-all. This could be helpful for some of the women, especially those who kind of use it more intensely. Whereas for others, we will need either to improve the app or think about a different intervention because what we offered them wasn't helpful. We did see that the majority of participants, 60%, did use the app for 7 days or more. But again, this means that 40%, used it very little. This slide comes to show that we wanted to see whether there was any link or correlation between the acceptability and the feasibility. And what you can see here on the right-hand side, the women that used the app for more days, like between 22 to 28 days, I mean, we had a few women that use it every day, which was really lovely to see. And then, some used it 15 to 21 days, but they were using it more than 2 weeks out of the 4 weeks. You can see that the blue number is sort of greater than the orange number, which means that most of them found it acceptable. Whereas we kind of see the mirror image in the women that used it only, a week or 2 weeks, the women that used it a week or less, like the majority is orange, meaning they didn't find the app acceptable. And just, the majority is sort of, they didn't find it acceptable and the minority found it acceptable. So this tells us really that the app, is helpful for, when people use it more, they think the app is helpful. And when people don't think that the app is helpful, they just don't use it. And we had, a little bit of feedback from the participants about the app. And, these are, quotes from our 30 participants that we interviewed. So kind of saying, it would make me more aware of where I need to change my surrounding or the urge to smoke. Others like the part that you could put your motivations for quitting, and then you're able to go back to that, and that can be helpful to remind you, why am I kind of struggling right now? Oh, it's because of my health or my grandchildren and so forth. We also got the feedback that, some women, especially the ones that didn't use the app so much, a lot of them said, well, you need to be really motivated to quit smoking in order to use the app and kind of benefit from it. So, the first woman said, she's tired of smoking. And the app helped, but then you need to be 100% ready in order for actually this app to be helpful. And another woman told us, I have no motivation or willpower for it. I was, just maybe it will help other women who are motivated, but not me. We got some nice feedback on the gender neutral content, which, people and women kind of appreciated, to the fact that they can do the self-tracking, record the reasons for smoking, and just kind of seeing the number day by day, how much they were smoking or reducing, that helped them quite a lot. And it was heartwarming to see some of the positive feedback we got on the gender specific content. For example, the videos that I just, we showed you one. So one woman said, I think every video hit home because everything they were talking about is how I felt or how I feel. So, we felt that some women related to the content. And another person said, I was reading the testimonials of people, and it's real people. You can relate to them, and it just gives you more motivation. So having the peer support, knowing that you're not the only one who's struggling to give up smoking, but actually many other women are struggling to quit, that can be quite empowering to kind of not give up and continue and push through. I also wanted to ask women about how to increase the engagement with the app, because we saw that the app works when people use it, but if they don't use it, then it doesn't work. So are there ways that we can make this app more acceptable so more people would want to use it for longer? So we've got some good suggestions. For example, maybe to add a game, sort of gamification, just to keep people interested in the app. Another person suggested to add new things, so sort of more of a dynamic content that would change from time to time, so people would have something to go back to. I mean, I've seen the videos, maybe I've seen it twice, but then I don't want to see it again. And right, maybe there could be a new video, right, every week, for example. And then we got this very interesting feedback from this participant saying, a live connection, when I can phone somebody and speak to them. And, in the video that we showed, we saw this woman saying, actually, just having someone to talk to, right? I called my counselor, my friend, my mother. That was really helpful. And we talked about how women tell us that they lack that social support for quitting. So what if we had that live connection, a counselor, a support, maybe like a sponsor? So women would, would appreciate that if they had access to additional support. So yeah, this is, our last slide for the presentation, and kind of summarizing what we've talked about. So specifically about, the trial that we did with the 30 women participants. Unfortunately, we didn't reach our predetermined acceptability threshold of 50% of women, which was perhaps ambitious. We reached about a third of women that thought the app was helpful, which is, like a colleague mentioned, it's not a small proportion, right? It's actually not bad. If we can help, even a third of the women, that's great. We also talked quite a lot about how, the more you use the app, the more you find it acceptable, and probably the more it can help you. But it also, kind of aligns with motivation, right? If I'm motivated, or if I feel that we talk about self-efficacy sometimes, right? If I feel that I can, that I can tackle this, if I feel that I can be successful, I'll tend to use it more. And vice versa. If I don't believe that I can quit smoking, if I think that quitting is too hard, if I have too many withdrawal symptoms when I try to quit, then probably I won't, use the app so much. I won't think that it would be helpful. We talked about how some women wanted more support, intensive support, maybe live support. At the same time, we know that, 60% of the women used it for at least a week, which is good. It shows some interest there. And perhaps with improvement, we could get a higher number of days of people using it. Yeah, and, something of a longitudinal support, just something to kind of come back, if it's through new content to, keep it going, or if it's through a counselor, some peer support groups that could, discussion boards, for example, that could be in the app, that would help, make women want to come more and use the app for more. Yeah, so I think this was my last slide. And I want to give a big shout out to a very big team that was supporting this project. We have a long list of our co-investigators here, and acknowledging the research team, Roshni and Kamna, the research coordinators. The video that you saw had the, the wonderful voice actors who are all members of our Intrepid lab. So we have, some talent, in-house talent, which we're very happy to share. And of course, acknowledge that this study was made possible with funding from the Woman Mind Seed Grant, which is an internal ChemAge internal funding that is designated to support women's mental health and women's addiction research. Okay, so I think we have a couple of minutes left to open it for a discussion with the audience. So thank you very much, everyone, for listening to the discussion. And yeah, I'm happy to answer questions that you have.
Yeah, also thank you, Dr. Melamed, for a very engaging and insightful presentation. And it was great to see how the study came full circle. But yeah, as you said, now's the time. If anyone has any questions, feel free to share in the chat. We can also, I think, share the video that was shown today too, right? At the end of the presentation, I can send it out to attendees, if that's okay. Oh, Carol said, following the feedback of the participants, are there any plans to actually modify the app?
Yeah, thank you very much, Carol, for this very good question. So one of the things that we are looking to do is make the app available for women. So right now we have just a My Change Plan app available for people who join STOP. We recommend that to them. Also, when people join STOP on the net, we recommend that to them. So one of the thoughts is to have a viable version that women could download. So we would say we have an app, My Change Plan that can, both men and women could use, but we've also developed one that's specific, unique to women. So maybe you want to try this. So one of our plans for 2025 is actually included, just have a workable version for anyone to download. And to your question, about how we incorporated the feedback of the participant and modified the app. I think, one of my take-home messages is that, probably the app can be helpful as it is for some women who are probably more motivated and want to do this work to help them quit smoking. But I think maybe what women are saying to us is that, it's almost, you're offering something that's not very promising to me because I feel that I have so many challenges in quitting smoking that I need something more than just an app. So the thought is, instead of improving the app, is actually trying to go to a different digital tool that perhaps can provide some of those, answer for some of those shortcomings of the app. So one of the thoughts that we're, planning, kind of the plan for 2025 will be to seek funding for taking this content that we've developed, the valuable work that, the time and effort that women have put into this, and actually translate it into a chatbot, a conversational agent that's based on AI. And the thought is, if I can maybe text, right? So just have sort of this live support, not by person, but by a conversational agent that's, a software program. Could that be helpful? Could that, keep women engaged with, kind of encouragement to track and feedback and answer questions that you may have? Plus all the content that we have. So one of the things is that we are kind of looking into maybe moving it into something more sophisticated. I could answer for that. Yeah, so thanks very much for that question.
Great. I think, someone else wanted to know, keeping in mind the importance in smoking cessation for the readiness to change, are there additional supports in adjunct to this app?
Okay, sorry, just looking. Yeah. Yeah, so, again, thanks for this question. I think that one of the things that we did in the app is kind of work on providing information. So, and a lot of the times, women tell us that it's sort of, they see it as a black or white, right? I'm either quit or I'm not. And we don't allow, also as healthcare providers and, people that they meet, we don't allow so much for women to be in this gray area where perhaps I'm just working on reducing, or perhaps, I can't quit. So all I can do is just work towards, reduction. And this process can take, weeks, months, sometimes even years. So I think, it's important to, to include this message, for women, right? The acceptance that, any effort that you put in towards quitting, whether it's just tracking, it's a really important piece of the puzzle, and we should be doing it, right? Even though I'm not ready to quit, this doesn't mean that I can't do anything to help with my smoking, right? I can work on some of those things that will later translate into some changes. Additional supports kind of adding to the app. I think it's, somewhat similar to my answer around maybe doing this. So two things, maybe kind of taking it into a chatbot, which could be sort of available to support. And another thing is, what, for example, if we change the app, what if, the app could have some content that's actually linked to any of you, right? Any of the providers that is working with me. So then it could, okay, I'm coming for my visit. Oh, I see you tracked. I see those triggers. Let's kind of work specifically about that, right? So one of the things we want to consider, right? What are the ways that we have to actually sort of embed this in the clinical work that's already happening, right? For smoking cessation, because I think that could be helpful. It means that, when I'm seeing my provider, I work, 10, 20 minutes with them, but then, for a couple of days, weeks, I'm working with the app, and my provider knows about what's happening with me, maybe sending me messages. Maybe it's kind of a, two-way communication. Just a thought, right? But I think that could be helpful.
Thank you. There was another, if you identify pregnancy when people sign up for the app and offer additional support.
Yeah, really good question. So for the women that we enrolled, the 30 women, pregnancy was actually an exclusionary criteria. The reason for that is that, if we have a woman that's smoking and they're pregnant, I would say we want to offer more intensive support to help them. I mean, it is sort of a time that, women are more motivated, we can provide more support. And then kind of thinking that the app maybe wouldn't answer for those needs. And also keep in mind that a lot of, there has been quite a lot of work done on women in pregnancy. And in fact, some of the, women-specific smoking cessation app that have been developed, not a lot, but there have been a few developed. I think the majority of them were for pregnant women. So we know that there are sort of different tools for women who are pregnant. And we wanted, our work was really focusing on kind of non-pregnant situations, which is the majority of women, if you think about it. Because I think at any given time, I think like 4% of women are pregnant. So that means 96% are not. So we do want to focus on the majority that sometimes hasn't been given a lot of support for quitting. But yeah, pregnancy, we usually would want to do it more in the clinical setting. And again, if we have a app for that, that would be good, but just more support in the clinical setting.
Thank you, Osnat. So I think we should start wrapping up, but if anyone has any additional questions that we couldn't get to today or anything comes up, I've left Dr. Melamed's email on the screen and they'll be included in the slides. Now, if anyone needs to leave, I know we're approaching 1, that's okay. I'm just gonna wrap up with some more housekeeping items, but thank you everyone for joining. Thank you, Dr. Melamed, and hope everyone has the good rest of your day. But yeah, so just a reminder that a link to the evaluation and post-learning assessment will be emailed to everyone who registered by tomorrow, and you'll have a week to complete it in order to receive a letter of completion. So that'll be December 11th. And just to note that our next Teach Educational Rounds will be another special Roberta Ferentz lecture on ACT application and addiction settings with Dr. Lillian Dindo. And that will be, oh, it says January 2nd, but it will be January 22nd, 2025. And registration for that will be coming soon. So stay tuned. And if you've missed a portion of today's webinar or want to view it again or any other Teach educational rounds, we do have an archive list available on our website. But again, that is it for now. Thank you, everyone. This was a great presentation. Thank you, Dr. Melamed. And I can tell everyone found this as engaging as I did. And I hope everyone enjoys the rest of your day. Thank you.
Thank you very much.
Bye.
Thank you.